This episode is brought to you by Vital Farms. Isn't it bullshit to have to question where your food comes from? At Vital Farms, you can trace your pasture-raised eggs all the way back to the source, the pasture. On the side of each pasture-raised carton of eggs, you'll find the name of the farm where your eggs were laid. And when you look the farm up on their website, you'll get a peek at all the sunshine, fresh air, and open space the hens enjoy. Learn more and find out where to buy them at vitalfarms.com. Vital Farms, keeping it bullshit-free.
It's time to say goodbye to hold music and say hello to fast customer support with Service Cloud. With trusted AI and data working together, you can skip long wait times and deliver efficient, personalized service right away, all while keeping support costs low and more customers happy. Reimagine your customer support with the #1 AI CRM for service. Learn what's possible at salesforce.com/products/service.
Hey guys, welcome to this week's podcast episode. I'm really excited about today's guest. She's a bread and butter guest, Dr. Rachael, and she's a physician in the aesthetics and wellness industry. She's got a interesting background. We're going to hear all about it, and I'm really happy to talk to her about aesthetics, medical aesthetics, recent developments, and it's going to be a fantastic show, especially for the physicians out there. So, Rachael, welcome.
Thank you for having me. I'm excited to be here.
Yeah, all my friends call me Chris. I don't like the doctor prefix, so please do the same. And kind of talk about your background, your education, your training, and we'll dive right into the conversation.
Great, thanks. So I am family medicine physician trained. I went through residency, and ever since then, I've been doing just kind of general primary care, full scope family practice here in Colorado Springs. I joined a federally qualified health center just right out of residency, did that for a couple of years. And then I joined a group practice in town, which was a physician-led group practice. And since I joined them, they got purchased by a large corporate entity 2 times, in fact. So my day has changed significantly, as many physicians out there probably have had similar experiences. And, with the corporate medicine, just changing landscape, I decided that I wanted to do something on my own. And I opened this medical spa. We've been open for nearly 2 years now, and just started completely on my own. I'm the only provider right now, although we just recently hired an esthetician who's going to be starting, and I'm super excited about that. So we've really grown a lot in the past 2 years, starting from very basic aesthetic procedures all the way up now to having multiple devices, energy devices that we provide a lot of services. So it's been an interesting journey the past couple of years.
Yeah, and what's interesting is I get this story more and more often is basically their doctors, institution or employer or whatever practice gets bought out, and then basically undergo a lot of turmoil. Physicians get let go, staff get let go. This is increasingly more and more common as healthcare starts to consolidate, and it's harder for physicians to be self-employed, do their own thing. Dentists, optometrists, all these, they can go out and start their own practice. Physicians should be able to do the same, which is what you're doing. Mm-hmm. And so we'll kind of talk about this idea of, we'll talk about entrepreneurship, but I want to talk about kind of this area of aesthetics and why it's so popular. It's also very lucrative as well, and how physicians can start to get into it.
Yeah. So I started off by just attending a conference where it was real basic, just kind of getting to know a little bit of the business, a little bit of procedures. And I just kind of wanted to, dip my toe in the water and just kind of see if it was something that I was even interested in. And I left that just really excited about the prospect of opening this practice, because I do feel like this is still an area where big corporations have not entered, and it's still very much like small business entrepreneurs kind of your mom and pop shops, just one-on-one with still doing patient care, but not having to deal with insurances and all of the bureaucracy around healthcare these days. And I really feel like I've been able to reconnect with my patients in a way that I've lost a lot of in my just general primary care practice. So it's been a really good transition. And I do feel like a lot of physicians would be interested in doing something like this.
Yeah. And you mentioned conferences, which conference, if you don't mind sharing the which conferences, conventions are good for physicians to kind of delve their feet in, learn more, get exposure, if you don't mind sharing that.
Sure. The one that I first went to is called it's IAPAM. I can't actually remember all of the acronym associated with that. Yeah. But I did that one mostly because it was close to me. It was in Scottsdale and I was able to drive there and kind of made a vacation out of it. And it also appealed to me because they were talking specifically about weight loss, which I figured even if I didn't do any aesthetics practice, that weight loss still applied to my just general daily life. So I went to that one for that reason. But there's a lot of really good conferences out there. Probably one of the big ones that's coming up in February of this year. No. I apologize. I think it's in April of this year. It's AmSpa. So that's the American Medical Spa Association. And that's probably one of the biggest ones. It's held in Las Vegas every year. And it's vendors, but also they have two different tracks. They have a clinical track and they have a business track. So you can learn a lot about business and about procedures. And they have a lot of really good panels. And there's a lot of resources there for good quality education outside of just conferences too. So it's a really good one to go to if you're interested in kind of learning more about it.
Yeah, really interesting. The next question I have is talking about kind of the primary revenue generators. So people, when they first get in, kind of talk about first they get in like Botox fillers, then they add on additional services, which is like, weight loss and, lasers and all of this. Kind of talk about these kind of developing a med spa around these revenue generators.
Sure. Well, we all think about Botox first. That's kind of like, for lack of better terms, like the gateway drug for aesthetics. So it's usually what people think of first when they start thinking about, I want to do something to enhance my appearance. They automatically think of Botox, even if Botox is not a good fit for them, or it is. That's the one that they think of. So a lot of people will start with those neuromodulator injections. One, because as a physician, it's relatively easy to learn how to do it, right? It's not hard to learn that anatomy again. It's not hard to use a needle. Like, most of us have the skills to easily do that. So that's a good one to start with. It actually, even though it is expensive, it doesn't generate that much revenue because the cost of the product is so high. And plus, not everybody needs neuromodulators. So I honestly started with that and chemical peels and facials. So I just learned how to do just skincare for people because everyone can use good skincare. And once again, it's easy for me to learn. I can, pick up a book and learn about all these ingredients in these skincare products. And, I'm not going to do anything life-threatening to any of these people with a chemical peel. So those are the two that I started with. And that was kind of my bread and butter for several months of just, getting people in and teaching them about, good skincare. And then are you a good Botox candidate or are you not? And then after that, that's when I started adding on the energy devices, because you just can treat so many more conditions with that. And of course, those are all like financeable. So, I added those on, and really that's where you generate the most revenue is with your energy devices, because those types of services are quite lucrative. And once you pay off the device, you don't have any overhead with it.
Yeah. Yeah, it's like high margin. And it's quite interesting because one thing that physicians, because you're family practice trained, and a lot of physicians are like, well, like I came from ortho, and then they're like, oh, I can't do this because I'm not derms or plastics, or I'm not board certified in derm or plastics. So kind of talk about these types of objections, and how people can kind of still get this skill.
Yeah. Well, first of all, as a physician, we're all, highly intelligent people and skilled and lifelong learners. And no matter what field of medicine you're in, I guarantee you went through med school. And if you could do that, you can learn a new skill. So these are just, additional skills that people can learn. And honestly, people with far less training are doing these things. So I would encourage more people to see, highly skilled medical professionals for these types of services, because they are medical procedures and can come with potential risks. So I feel like a physician is the best qualified, no matter what their previous training is, to do these types of things. So I would just encourage anybody of any specialty to kind of take a look back and say, you can really do these things. It takes additional learning. And I know that any physician is capable of it.
Yeah. Yeah. I know actually a lot of physicians, outside of derm and plastics, even family, and they have these private practices, and they just kind of, they get the skill, and they do it safely and competently, and they do it well. And then they just add these additional services just for additional revenue. It's like no different than adding a new product line, or kind of just a new revenue stream. So which is quite interesting. Yeah. The next question I have is this idea of mobile versus physical location. You obviously you're in this you're in a clinic right now, but a lot of people, there's more like a mobile type practice. Kind of talk about, do you need a physical location? Is mobile better? Kind of, the advantages, the disadvantages, all of that.
Yeah. So definitely a lot of these things you could do pretty mobily. Like it'd be hard to do it with a Morpheus machine or something like that, but you can easily do Botox or filler. Just, you bring your cooler along and your supplies and set up and do that out of somebody's kitchen. Now, of course, you have to think about in the safety aspects of that and the cleanliness. But of course, if you're going to be doing it, I would assume that somebody would take those kinds of precautions and make sure that it's performed safely. Yeah. So you certainly could. I just think that you would be limited in the number of services that you could offer. But a lot of times, if you're just getting started, like that might be a great way to start, and very little overhead that way. You just have the product that you're delivering to people, like at their homes, or maybe a central location that they pick, something like that. Yeah. And that could definitely be an option for many people.
Yeah. Yeah. It's always this, because with the physical locate, like with the mobile, it's like you have low overhead costs. Of course, patient safety always number one, compliance with the rules and regulations number two, because honestly, this is all cosmetic, so it's not life or death type situations. The other question is kind of talking about, so a lot, I've gotten a lot of questions around semaglutide and tirzepatide, and I kind of steer clear away just because I want to, there's a lot of hype, and every time there's hype, there's there's something, and if you have to become more cognizant and kind of be on alert. So kind of talk about semaglutide, tirzepatide. And again, for the audience, this is not advice. You have to seek a professional. We're just talking these concepts, just kind of putting it out there.
Yeah, exactly. So those are medications that I do offer for certain appropriate use, right? The reality is that in my day job, I get asked about these medications more times than I can even count.
Yeah.
And there's a lot of people who could benefit from some weight loss assistance. They don't want to go through surgery, and nor do I blame them. And once you reach a certain weight, a lot of times diet and exercise can only get you so far. So I can understand people wanting to have assistance with weight loss, and these medications are really expensive and not all insurances cover them. So that's why I decided to add it on to my weight loss practice and getting them in a compounded version from compounding pharmacies. So that's how I'm able to provide it at a lower cost. But in my practice, what I do is I always have a sit down consultation with the person beforehand. We talk about the medication, whether it's appropriate for them or not. If they haven't had labs within the past year, then I order labs, those kinds of things to make sure that they're an appropriate candidate that way, and that there's no red flags for thyroid cancer or things like that. So I always do that. And then I require them to see me for at least 3 months one-on-one. So they're not just coming in and picking up medication and just be like, bye. No, they have to have a visit with me for at least 3 months just to make sure that they're tolerating it, that they're taking it safely and appropriately. I teach them how to administer it at home, because I do provide them with a month's supply that I draw up myself, and then they self-administer it at home. So those are the steps that I take to make sure that it's done as safely as I feel like I can make it. Because the reality is that people can just go online and purchase these medications, or also do a telehealth visit in some cases, and then they just get the medication shipped to them. And I would rather them do it safely and make sure that they're taking it appropriately and having guidance with it, instead of just buying it off the internet from who knows who is giving it to them. That's kind of my approach on it, just to make sure that I'm delivering it in a safe way. But it's been very helpful for generating new clientele for my practice, because once we started offering it, those are people who are potentially interested in other aesthetic procedures. So that once again, it's kind of a way to get people into your office.
Yeah, it's quite interesting. Like I said, I get a lot of questions as that. I kind of steer clear because I'm more along the lines of patient safety. I want to see, before anything goes, if something is too hyped, it, kind of puts me on alert. So really interesting. If people want to contact you, follow you, check out your work, etc., how can they do so?
So the best way to reach me about this type of information, if you have questions, which I'm more than happy to do and answer questions about this industry and how I got into it, is on LinkedIn. And then if you just want to follow my office in general, we are Pearl Skin and Body Rejuvenation. We're in Colorado Springs. We are on Instagram and Facebook. And then, of course, you can visit our website, which is pearlskinbody.com.
And for all the audience out there, let's thank Dr. Rachael for coming on, really talking about this really interesting industry. And all of her resources will be in the links and show notes. Be sure to follow her on Instagram, give her a like and follow, and check out her website as well. And with that, thanks so much for coming onto the podcast.
All right. Thank you for having me.